therefore had one eyebrow sitting up very high and the other one sitting very low, and things just looked very off, even into her mid-face section. I always love a good challenge, and so I was able to do some very asymmetrical Botox for her and get her eyebrows to the same level in just one visit. And it had been 10 years since they had been that way. Things like that definitely bring me joy.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Ami Montague, who has over 27 years in the industry and more than 20 as an injector. She's the owner of Saltbox Aesthetics and Saltbox Aesthetic Institute in Dallas, which recently expanded due to its growing success. She spent a decade training thousands of medical professionals at the National Laser Institute and has been a faculty trainer for Allergan Medical Institute since 2017, delivering over 250 trainings across Texas as one of their top 3 most utilized trainers. Passionate about advancing the field, she dedicates countless hours to her own continued education, including yearly hands-on cadaver courses, ensuring she stays at the forefront of the latest injection techniques and safety standards. So Ami, welcome and glad to have you here.
Thank you so much for having me, Daniel.
So let's dive right into it. How did you first get interested in aesthetics?
Oh gosh, that's actually kind of a funny story. So my mother bribed me to apply to nursing school. And I literally mean she bribed me when I was very young. And so I applied and I didn't expect to get in, and I did. So nursing was never something that I had thought I wanted to do. I always thought I wanted to be a teacher. However, I somehow got into this very competitive nursing program and found midway through that I am way too empathetic to be dealing with sick people. And so as I progressed through the program, I started considering what ways I could spin my education and still use it, but using it in a way that would bring me joy. And that's how I came upon aesthetics.
Nice. So you have 2 different businesses. So you have the Saltbox Aesthetics, and you also have the Saltbox Aesthetic Institute. Could you kind of give me like a 30,000-foot view of what each of these businesses do?
Absolutely. So the Institute actually satisfies my need to be a teacher, which is wonderful. I love the training aspect of what I do. And so it is, I would say, the least amount of time spent on training compared to being in the office seeing patients, but it's probably about 20% of my time, and I love every minute of it.
Okay, and so between both of these businesses, I guess I want to focus a little bit more on the Institute side. So you trained lots of injectors throughout your career, and you must have seen a lot. Not just training injectors, but also seeing what they're doing in their practices. So could you share a little bit more about what you've observed in those environments, in the situations, and kind of what you brought that over to Saltbox, or how it's different to what you're doing in Saltbox?
Absolutely. Having worked at quite a few different places in my career, as well as having seen so many different med spas, especially here in Texas, one of the things I've noticed with this growing trend of corporate-owned med spas is that we are losing patient care a little bit and starting to focus way too much on revenue. And even to the extent that I was at a training about a year ago, and 2 nurses were very upset because they had been told by corporate headquarters that they were required to do X amount of under eye fillers every month, or they wouldn't be getting their pay as they normally would for their bonuses.
Wow.
And I think that's really ethically wrong, especially as doctors and nurses. We take an oath of ethical practice and do no harm, and putting quotas on aesthetic practitioners, I think, is wrong and something that I would never do at Saltbox.
And I've been seeing more and more of these big companies, corporate companies, hedge funds, venture capital coming into the medical spa space and buying up these practices, trying to roll them all up, and then whether they want to keep it to make money off it or sell it to somebody even bigger. But as far as this trend goes, do you think that the trend is going to go in this direction where this is going to become more commonplace and even more of a need for practices such as yourselves that are privately owned to spend a lot more time with the personal side, the more, not to say that the corporate ones are not empathetic, but like a lot more of that personal touch? Do you think that it's going to almost swing back in that direction where like your type of practice needs to have more of that personal touch, that like individual care? Like, do you think it's going to swing more in that direction?
I hope so. And I have to say, not all of the corporations are bad, right? There's good ones out there that do it really, really well. I do think that patients can tell when they walk into a business and have interaction from the front desk to in the treatment room if they are being driven by hard sales, right? And I don't think anybody likes that. I know I dread going to the car lot because I don't like the feeling of being aggressively attacked and tried to, sold something that I don't necessarily want. So I do think that patients are going to demand it in some respect. On the other hand, it does make it really difficult when a large corporation owns a med spa or a group of med spas. They get the best pricing possible from the manufacturers of all of the products that we use. So it's a very unfortunate situation for us small businesses that we're not getting that same pricing. And I hope that someday that will change as well.
I see. And when it comes to specifically your practice, could you talk about some of the most common treatments that your patients, your clients come to you for? And also, why do you think that they're so popular?
Oh gosh, we have so many fun things at Saltbox, and it feels like it's changing all of the time because the industry is just growing with new treatments being added. I would say though, our biggest sellers are Silfirm X, which is RF needling. And that's because everybody suffers from skin laxity as they get older. It might happen at different ages for all of us, depending on our lifestyle, but it's bound to happen at some point. And that's a great way to either prevent it from happening or to correct it as long as it's not too far gone. And then restoring some of that volume loss with fillers is definitely a big priority for a lot of our patients, as well as stop making the faces that make problems. And that would be with Botox or similar products. So we stop those muscles from moving, and then you don't develop the wrinkles.
Got it. And is there one treatment in particular that you find particularly special or that kind of means a little bit more to you than the other ones?
Definitely. I am so passionate about I call them liquid facelifts, but they're basically facelift with gel fillers. And I use the fillers for facial balancing or enhancing someone's features, or perhaps giving them what nature didn't necessarily give them in the first place. So if someone has an extremely weak chin, we can correct it in under an hour. There's just so many things that I can do with those facelifts. And the nice thing about them are the patient puts their trust in me and lets me do what I think is going to benefit them the most.
And why in particular was it this one that you picked out of all the other ones out there that was really special to you?
I think it has to be the patient's reactions when they see themselves in the mirror. It just brings me so much joy to see someone look in the mirror in shock after only being in the chair for an hour and looking like they're 10 years younger. Seeing that look of disbelief and even sometimes some tears of joy never gets old.
Yeah, I'm sure that's a great reason, great motivator. I can see why it's a special one to you. Now, I'm curious, are there any new or emerging treatments that you're particularly excited about that you're seeing kind of coming out there, or maybe it's getting more popular, or just where you think the future is going to?
There are some new things I'm excited about. So 2 of them we have already, and one I should have at the first of next month. Exosomes are huge right now. So we carry Benev's exosomes and we're using them topically in so many ways and getting excellent results. and PDGF. So these two kind of go hand in hand. So platelet-derived growth factors, and they're very similar in what they do, but we're actually injecting the PDGF and using the exosomes topically to get very remarkable results without actually putting a filler in, or even without doing Botox, and just seeing big improvements in skin integrity.
And for people who don't know what these types of treatments are, they fall under the category of regenerative medicine. So could you explain a little bit for people who just have no idea what this is? Like, what are these things? What's regenerative medicine, and why is it now relevant to aesthetic medicine?
Absolutely. I think we're seeing a big push in this in all realms, right? So I know I personally am doing functional medicine now instead of traditional medicine. I am trying to prevent disease rather than waiting for it to happen and trying to correct it in a much more, I feel like it's a much more natural way as well, boosting your body's own ability to heal itself and regenerate itself. And so exosomes are interesting. They actually come from a single cell donation of a 20-year-old Korean girl. I heard from the scientist who created these in South Korea, and a very healthy woman. They took some of her tissue and they've been cultivating it in a laboratory for years to derive all of her really youthful growth factors, and then basically purify them, turn them into a powder, and we're able to mix them in with peptides, amino acids, hyaluronic acid, and make a topical that can be applied to the skin to make it really glow, look younger, stimulate collagen and elastin. PDGF is very similar, but it's bioengineered. So there is no human DNA in it, but it has the growth factors that we want. And it's already being used in orthopedic surgery. Actually, it's been used in ortho for a long time, and it's just making its way into aesthetics now. But when it's injected into the skin, it helps you build your own collagen and elastin without me having to add any sort of filler, where I feel like some patients are a little bit nervous about filler. They don't know if they want a foreign body in their face. And so it's a good alternative for someone who's really youthful, or someone who doesn't want to have filler for whatever the reason may be.
It almost sounds like it's science fiction from the way you
explain it. We're lucky to live right now, Daniel. That's all I can say. I hate to think what I would look like, if I were in my grandmother's generation. I'd probably look like my grandma.
It's wild. It's wild, the technology out there and just what it can do, and especially from what I've been seeing also, I'd like to know your thoughts on this. I'm seeing more of a general push in the direction of more natural looking. Like, people don't want the done up anymore, like they look like they had work done. They don't want that. They want the natural. And even for the treatments, they're now looking for more natural treatments as well. So, I mean, have you been seeing that there's been a little bit more of a shift in that direction from the general public?
Absolutely. And thank goodness. I have always been on that boat. So I feel like everybody is catching up to me finally, but I've always been about the natural. And as a matter of fact, at one of my jobs I worked for 10 years, I had a colleague who, when someone came in wanting really giant lips, I would tell them that I couldn't do it for them, but I would send them to her. And she would be happy to give them, the overdone look, but that's just never been me. So in my practice, I've always had the patients that didn't want to look like they've had anything done. A huge percentage of them have husbands that have no idea that they get treatments. And so I've really honed in on how to minimize bruising, continue people, getting people to look natural and like they haven't done anything, as opposed to the alternative.
Okay. So I think this is one very big area that really differentiates you from a lot of other people in the industry, and that you are ahead of it so far than everyone else. But I want to dive a little bit deeper. What are some of the other areas that you would say really differentiates you and your practice from others in the industry?
Gosh, it would have to be, I think there's a lot, but I think the fact that we are like one big family, from my staff to the patients that come in. I get to know everyone personally. I think we have, it's really close to 1,000 patients in our in our books right now. And it's amazing to think that I know each and every one of them and know about them and look forward to their visits during the year. And staff is the same way. And I treat them just like I would my family.
Wow. I mean, I think it's incredible because some businesses talk about that, but I mean, I can kind of see from your voice and also just from what you've had with your businesses, like you really mean it. It's like I think people can feel it with you as well. And that kind of leads me to my next question is, when it comes to the way you treat your patients, way you treat your team members, I want to know how you how do you approach educating your patients about the services you offer and the benefits? Because I'm sure you get some people that come in and they think they want one thing, but they really need something else, or maybe what they think they want is just completely wrong. So how do you approach educating your patients about what you do?
I think that I have the gift of education, which is very lucky. There is a good chance I am telling patients way more than they even want to know. And I try to be mindful of that, staying on time, but educating the patient in the way that makes sense to them. So I'm really big on figuring out the personality types of the patients in the chair and trying to utilize my skills in, the little bit of psychology that I studied to be able to get the education there so that they understand why it is I'm recommending that we do something else, or that I'm saying we shouldn't do something that they wanted to do. I actually had someone come in who wants her lips done, but she has a very recessed chin. And if we do her lip, her chin is going to look even more recessed, which is going to really throw off her profile. So I told her, I'm not going to do your lips unless we do your chin at least a little bit and keep it where it was before. I don't need to make you perfect, right? You get to be unique. You can still have a recessed chin. I'm fine with that, but you're not going to be having lips sticking way out from your face if it's not going to look natural. And that's, I think, where that education comes in. So we look at the pictures together and I explain why it is I'm making that call.
I think that's one really important point that you brought up that I really want to highlight, is that you mentioned that in this case, you would not have done it if she didn't also do something with her chin. And I think that's a very important distinction, because a lot of people out there in the marketplace they just take your order. You want this? Okay, I'll do it for you, when it's not in their best interest. But in your case, it's you really put the best interest of your patients and clients first, even if it means that you're not going to work with them, but you would rather do the right thing than do the wrong thing and get money from it. So I think
Absolutely.
It's a very important distinction that not everyone has that mentality, where it's just, you're willing to pay me? Okay, you pay me, I'll do what you want. But not in cases where this is not the best fit for you. I'm not gonna do this if you don't do this as well, because this is gonna be the best solution for you, and I don't want to give you the wrong solution. So I think it's a very, very important distinction. Now, when it comes to misconceptions, I'm sure there's a lot of misconceptions you get from your patients, whether it's they think that this thing is going to do really well for them, or maybe even like they have a misconception about, oh, this other thing is really bad, when in reality it could be good for them. So would you mind sharing a couple common misconceptions that you've heard from some of your patients, some of your clients, about the treatments you provide?
Oh, Daniel, I am so glad you asked me this, because this has been a huge topic of conversation at the office this week. There are three misconceptions that are out there right now that are making me bonkers. So one is there was a doctor who came out with an image of one patient and basically said, filler put in your face never goes away, it just moves around, which is completely untrue. And so having what's going on online on my radar is really hard for me, because I don't have a lot of time to spend online. So it usually happens that someone's in the chair and then shows me and says, I don't think I want filler anymore because look, and then we have to have a conversation about it and address it. So that's one. The second one I just saw, I had a patient in the chair. Her friend texted her an online video of some, again, doctor saying that RF needling is very, very bad and saying all these awful things that happen with it and that you should never do it. And it really upset me because the bottom line is with any device, if it's in the wrong hands of an uneducated person who doesn't understand how to use it properly, all devices can be very problematic and have awful side effects. So the key is you need to know who is performing your service and do they really understand the device. I was a laser instructor for 10 years, so I taught laser biophysics and histology of the skin. So I have a deep understanding of how most of these devices that are out there work. And I train my staff how to use them properly and what can happen if you don't. And I think that's the key. Now, the last one I heard made me laugh, and this has gone around off and on for years, and it's that sunscreen gives you cancer. And that one is preposterous as well. But I tell my patients, don't use a chemical sunscreen. Pay attention to the ingredients and what you're using. If you're not getting full spectrum coverage with your SPF, you are potentially staying out in the sun longer without getting a sunburn, but still getting those aging rays and cancer-causing rays at a higher level because you're spending all that extra time outside. So you need a full spectrum UVA, UVB protection. And I could honestly go on for 15 minutes just about sun protection. So I won't do that right now, but that was one that I heard from a patient actually on Saturday over the weekend. And I was like, no, it's not true.
Well, thank you for debunking those and putting it into easy to follow format. But that's important because, like, again, like a lot of people have these misconceptions, like, oh, like who do I listen to? Oh, I heard this one doctor, so I don't ever want to do it. And then it's wrong information, and they could be going down the very wrong road because they only listen to one person or someone that wasn't very educated or knowledgeable in that field. Now, I want to dive a little bit deeper into when you actually are doing the treatments for your patients. How do you balance between providing that relaxing experience for them, making sure that they're not nervous or scared of needles or whatever it is, but also ensuring their safety and well-being during the treatment?
Oh, I think that's actually really easy. I specifically designed my med spa to put people at ease as soon as they walk in. I have rules about what the music can be like. It's not boring spa music, but it's super chill, like lo-fi music that people who've never even heard that type of music before, like, this is really cool. And I think a lot of it too is the demeanor that we have when we're working with someone, right? So if I am touching my patient beforehand, sitting with them and letting them know, what we'll be doing, asking them how they deal with pain and how I can make things easier for them. Then they know we're on the same team, and then I'm not just going to go in and start doing really horrendous things that hurt them a lot and keep going. I have some little distractors that I use, a little facial vibration that utilizes the gate theory of pain, squeezy balls. I even let a patient set up her, I brought in my tripod and let her put her phone up so that she could watch one of the housewives show, which was super entertaining to me because I could just hear it because I was injecting her, but I don't watch those shows. So I got a really good idea of what those are like now. But she was enthralled with her show and wasn't paying attention to anything I was doing. So I'm happy to work with people however I need to. But the bottom line is most of the things I do, I've developed ways of doing them that really aren't very painful at all. So mild to moderate discomfort is usually what patients report.
Got it. Now, for this next question, I'm actually curious how you're going to answer this. So when people think about medicine, they think about there's a step-by-step process, there's a protocol in place. But in your opinion, what role do you believe creativity plays in how you approach your patient care?
So there are differing opinions on this. I have worked with Dr. Mauricio de Maio, who is a famous Brazilian plastic surgeon who only does filler now. And he trains for Allergan. He does a lot of traveling all around the world. And he actually developed a very systematic way of doing filler called the MD codes. I know how to do it because I've studied with him, but the artist in me has a really hard time sticking to that protocol. I, in another lifetime, won a lot of artists, let's see, like t-shirt design contests, art contests in grade school and middle school. And so the artist in me really loves to look at a face and figure out what it needs for harmony and balance. I think it can be done both ways though, depending on the way that the brain of the injector works.
Okay. Yes, because I think it's interesting. I think a lot of people in the aesthetic space have that artist streak. Like there's some part of them that's an artist. So it's, yes, you have to follow the protocols for safety, but aside of that, like everyone's a little bit unique, everyone's a little bit different situation. It's like you need to have that artistic eye to make sure that they're getting really what they want. So now, Amy, I'm sure that throughout your entire career, you've run into some particularly challenging cases. So could you share maybe one story of maybe a case that was really tough and how you were able to come through that and get them really amazing outcome at the end of it?
Yeah. Who should I choose? There's a couple that come to mind. One was a woman that had been brutally attacked for thieves to steal her purse, an elderly woman. I don't think I'm going to use her, but we did have some great results with her scarring. I'm going to use someone who had a facelift, and on one side of her face, she had some nerve damage that caused her to droop. And she therefore had one eyebrow sitting up very high and the other one sitting very low, and things just looked very off, even into her mid-face section. I always love a good challenge, and so I was able to do some very asymmetrical Botox for her and get her eyebrows to the same level in just one visit. And it had been 10 years since they had been that way. And then we were able to do some filler to camouflage some of the other asymmetries that had happened due to the surgical procedure. Things like that definitely bring me joy.
Yeah, I think it's pretty incredible because when I ask people, like, what is their best success story? Very often the stories are about people that had some type of, I don't want to say disfigurement, but like something that was off with them. And then they just wanted to go back to feeling normal. They just want to go back to feeling like themselves. And I think a lot of people think about the aesthetic industry and like, oh, it's just about vanity. They just want to try and maximize their beauty potential. But that's really not most cases. Like the most impactful stories, the ones that really all the injectors, the providers, the ones that really stick out in the minds are the ones that really they made an impact in that person's life, where they're like, I can feel like myself again. I can feel like I'm just normal again. And I think that's one thing that's missing in the industry. People don't realize it's about making you feel like yourself again, not about just trying to be maximum beauty.
I agree. And even if you think about the aging process and how long we're living now, and how healthy we're able to stay as we enter into, our older years, feeling a certain way inside and then walking by a mirror and seeing something totally different. I don't know about you, I'm older than you, but I still feel like I'm 25, and so I forget. But if I looked in the mirror and I looked, 80, that would be very distressing. And so hopefully as I age and as my patients age, I'll be able to keep them in that, I look similar to how I feel on the inside.
Yeah, completely agree and completely understand as well. So, Amy, we talked about this a little bit before, but I want to dive a little bit deeper and see, where do you really think the future of aesthetics is going, kind of overall?
I guess I would have to say we're definitely going more natural. We are seeing people start treatments very young. And some of these treatments I think are awesome. Botox at a younger age, that's totally fine. I think we can train our faces to not make ugly faces that will then develop into wrinkles. No one needs to look angry, right? We should be happy all the time, or at least pretend we are. But I think that some of the things that are happening, I'm a little concerned about, and I hope they shift. So I'm seeing a big push for very young people doing biostimulators like Sculptra. And although I think Sculptra is a wonderful product and I have it in my office, I don't think it's appropriate for young people, especially not in their faces. Maybe in their body, booty treatments and things like that, that's fine. But I've been inside of faces that have had a lot of Sculptra, and there can be a lot of it feels like scar tissue in there because you've developed some collagen, which is what a scar is made of, from the sculpture having been put in. And so I think we need to be very cautious moving forward about what we allow these young, 20-somethings to do, because these are potentially permanent changes to their skin. So keeping it natural, very good. And then also guiding younger people and not letting them go overboard at a young age with natural treatments like biostimulators.
Okay, sounds good. So Amy, I have one last question for you, but before I ask it, I want to point people to your website at www.saltboxdallas.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
I think they need to pause and don't be in a rush. Take their time in finding the right fit. I really feel like meeting with the potential injector is a must. And so we do free consultations. Patients do pay a deposit to hold their spot, but they can use that money at Saltbox any way they want. And if someone isn't a good fit, either for me or I'm not a good fit for the patient, then they can move on, because I think you need to be aligned with the vision of your injector. So I see a lot of people come in that say they went somewhere for a consult, and when they walked in the office, they were scared because everyone's lips were way too big, including the injectors and the front desk. And, all the staff looked very well overdone. So I think getting a feel for what's going on at the office is a very good idea before you make a commitment to actually getting your treatment.
Okay, well, there you have it, Amy sharing her expertise. So Amy, where can people contact you in your practice?
So we're in Dallas, Texas. We have online booking, so you can schedule online through our website that you just shared, or patients can call or text us, and we get right back to them. Our phone number is on the website. My email is info@saltboxdallas.com. So there's a multitude of ways to get in touch with us. And I have Mackenzie at the front desk who's happy to get back to people as soon as possible. And if she's off, then I do it. So I'm pretty much here 24/7, Daniel.
Well, Amy, thank you for sharing your expertise. Thank you for sharing your knowledge. I think it was a lot of great items that you shared with everyone.
Thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.